Hi, my name is Nimer, and today I will talk about endotracheal tube suctioning. Now, before I proceed, let's talk about the purpose. The purpose of this procedure is to maintain a pattern airway and remove pulmonary secretions, blood, vomitus, or foreign materials from the airway. Now, before I start, I need to gather my materials. What I need is a Guido airway, ambu bag, saline or sterile water, stethoscope, small basin, sterile glove and medical glove, suction catheter, and suction machine. Before I proceed, I perform hand hygiene. I provide patient privacy. I introduce myself. Hi, my name is Nimer. I will be your nurse on this shift. I use two patient identifiers. I verify allergy status. I perform environmental safety check. I ensure proper body mechanism. I gather all supplies I need. I provide patient education. Good morning or good evening. Today I will perform ET sanctioning. The meaning of this, I will be removing all the secretion from inside the tube. That's to help you out to breathe well. Now remember that when I insert my catheter, you will feel a little pain and you will cough a little. That's okay. Make sure that the patient understands that as well. Now I go ahead and adjust the patient position. Now if the patient is conscious, I'll put him on semi-Fowler position. If the patient is unconscious, I put him or her on side lying position. Then I put a towel across the patient chest, and then I go ahead and turn on the suction to appropriate pressure. Most likely the pressure is going to be 100 to 120. And now I auscultate the patient. I put on the stethoscope and start auscultating. After that, I plug the end of the connecting tube. Now that's for me to check the pressure, the air pressure or the suction pressure. Then I place the ending tube to any place near me or convenient to me. And now I open the sterile suction package using a septic technique. Carefully, after I remove the wrapper, I carefully remove the container, touching only the outside surface and put it next to me. Now I pour a little bit of saline solution in it, about halfway, and then I continue the setup. And now I put on the sterile glove. First I will start gloving my dominant hand, and then with my dominant hand I put on the sterile glove on the non-dominant hand. Now since I'm sterile right now, I can touch the catheter, the suction catheter, and take it off from its package. Now here I hold the catheter with my dominant hand, which is this is gonna be the sterile one, and with my non-dominant hand I hold the ending tube and connect them together. Now for me to check for the pressure, I use my thumb to plug the white port, and that's to check if I connect them correctly. After that, I moisturize the catheter. Now I apply the suction by intermediately clogging the white port on the catheter with my thumb on my non-dominant hand and gently rotate the catheter as it is being withdrawn. After that, I flush the catheter with the saline. After that, I repeat again if needed. Now, if I need to repeat it again, I make sure that I hyperventilate my patient and then I go again with the suctioning. Now, allow at least 30-second to 1 minute interval in between and then continue until there is no secretion. As well as after suctioning, you can provide the client oral hygiene where you suction the mouth from any other secretion inside the mouth. But careful not to put the suction catheter inside the tube after you did oral hygiene. Now after that, I disconnect the catheter from the ending tube using the dominant hand, take off the blood, wrap them around and dispose them and put them on top of the wrap that we used earlier. And after that, dispose them in a disposable bag. After I finish, I do a hand hygiene. I perform hand hygiene and I turn off the suction machine. After that, I reassess the patient for respiratory status. I auscultate again and see the breath sound and check for the respiratory rate on the monitor if it's okay. And then I document the observation and the procedure. That's all for suctioning. Thank you.